An unidentified mink farm in BC is now under quarantine after animals and workers tested positive for COVID-19.
It seems just immoral to be making these animals suffer.
Those opposed to fur farms say the outbreak is another reason to bring an end to the practice. However, those in the industry say the single outbreak is a sign of care being taken. BC's chief veterinarian says the disease in the animals is mild and the quarantine order will prevent it from being transmitted off the farm. For more on this, I'm joined by Dorothee Bienzle, professor of veterinary pathology at the University of Guelph. Good to see you, Dorothee. Thanks for your time this morning.
You're very welcome.
So, should we be alarmed by this news?
Yes, we should be alarmed. The disease spreads, or the infection spreads very easily in mink, and it's very hard to contain it within mink. And the virus can go back from mink to people. The mink likely got infected from people in the first place, very likely. But we know now from the experience in Denmark and other countries that the virus can also go back from mink into people, and that virus may be changed a little bit. So it is cause for concern.
So we all know the ability for viruses to transmit between humans and bats. Now we're learning mink. Why mink?
Well, as far as we can tell, mink are highly susceptible. The receptor that the virus uses, which is called the ACE2 receptor in mink, is it's very similar to the one in humans, and it's very adapted to binding the viral protein. It's the S protein in the SARS-CoV-2 virus, and it interacts with that receptor in mink very well. And so they're very prone to being infected. We don't know where the receptor is expressed in mink, but it's likely expressed, same as in other species, throughout the nasal cavity and in the lungs and other organs.
Is it as debilitating to them as it is to some humans? I mean, some people do contract COVID-19, only have mild symptoms, some are asymptomatic. Is it the same for mink?
Yes, we've seen this in some outbreaks that have been studied quite well, and it seems to be in mink also similar, that the majority of animals get either no disease, no overt disease, or mild disease. A few get pneumonia and a few die. Now, we have to keep in mind that mink on farms are kept in very crowded conditions, and so the opportunity for transmission of the virus is much higher than it would be in the general human population.
I think one of the more alarming things that you've said is that the virus does mutate somewhat when it is transmitted to another species, as it were. So what does that mean? Does that mean if it were to escape that farm, would the virus be a different form of what we're familiar with now with COVID-19?
We don't know that for sure yet, but there is a possibility that the virus may be mutating if the virus is replicating at a very high rate, which it would be if it is in a mink farm, which it likely would be because the mink are very crowded and there's probably a firestorm of infection going throughout the farm. So there is the opportunity for the virus to mutate at a relatively high rate, and that could convey in a new, slightly changed virus that is being transmitted back to humans.
And Dr. Bienzle, does that mean the COVID-19 vaccine developed by Pfizer would not work on a mutated COVID-19?
We don't know that yet. I mean, it's a large protein, and even if a few of the proteins end up being changed, that may not impact the vaccine. So that's too early, and it's speculative at this point.
Right. Okay, I have 30 seconds left. What's the messaging then? They must contain this to that farm. What else can be done?
We must try very hard to contain it, and we need to also keep in mind our native wildlife that is in the mink family, such as wild mink, ferrets, etc., who would also be susceptible, highly susceptible.
Okay. Well, I appreciate your expertise. It's been a fascinating interview. Thank you so much for your time.